Good day, ladies and gentlemen. Today we continue talking about anatomy of cardiovascular system, and topic of our today's lecture is very important. It is functional anatomy of lymphatic and immune system. This topic, of course, very important for your future job and also in connection with our today's pandemic situation with coronavirus infection. This topic will help you to understand mechanisms of body's protection, mechanisms of immunity, and I hope will be very useful for you. And first of all, we have to tell what is the lymphatic system. It's a definition of the lymphatic system. It is a system of the lymphatic capillaries, small and large lymphatic vessels and lymph nodes, which are interplaced in the pathways of the vessels. It provides the drainage of the fluid in the various organs and tissues, together with the veins, and moving of different waste products, bacteria, and other foreign substances. It also participates in lymphopoiesis and immunity. And I can give you one advice to memorizing the members of the lymphatic system. Please look to the red words in this definition, because even if you will remember these red words, you can easily describe practically all members of the lymphatic system. And let's start talking about the functions of the lymphatic system. First function is the function of the drainage. It means the conduction of the lymph from the capillaries to the large veins of the neck. By this way, the fluid from the interstitial space is returned back to the blood circulation. Next function is the keeping of the homeostasis. It means the constancy of the interstitial fluids composition and volume and microenvironments of cells. Next function is formation of the lymphoid elements, in one word, lymphopoiesis, production of lymphocytes, and transport of antigens and antibodies. Next function is the neutralization of the foreign particles and bacteria. That's why we're talking about the lymphatic and immune system together, because these two systems are very close to each other. Next function is the spreading of the malignant cells. The metastasis, spreading of the malignant cells, quite often occurs through the lymphatic pathways. It's because of the morphology of the lymphatic vessels and lymphatic capillaries, and we will talking about that a little bit late. Then is the metabolic function, means the transport of the proteins, enzymes, minerals, and hormones. I will talking about the development of lymphatic system. It starts approximately from the 6th week of embryonic life by the formation of the jugular sacs. The jugular sacs are formed in the place of future jugular veins. Another lymphatic sacs are also formed in the retroperitoneal space and also in the place of future iliac vessels. And then these mentioned lymphatic sacs will give rise in future to the thoracic duct and also to the lumbar trunks. Approximately from the 7th week of embryonic life, the lymphatic trunk, intra and extra organic lymphatic vessels start to develop. Then the lymphatic nodes are formed, and finally the connection in between the lymphatic and venous system will be formed. They thought quite long time these two systems are developed together, but then it was discovered really lymphatic and venous systems are developed differently from each other, and just then the connection in between them will be formed. As I told you before, lymphatic system consists of the lymphatic capillaries, small capillaries starting from the periphery. These lymphatic capillaries then match together and form lymphatic vessels, interrupted on pathway by the lymphatic nodes. Then bigger diameter lymphatic vessels join together and form lymphatic trunks. Finally, lymphatic trunks empty into the lymphatic ducts, and lymphatic ducts return fluid back to venous system. That's why we're talking about the lymphatic system as a component of vascular system, because it also consists of the vessels. So the members of lymphatic system, we'll repeat again, start from the lymphatic capillaries. Then these lymphatic capillaries empty into the intraorganic lymphatic vessels, then to the bigger diameter extraorganic lymphatic vessels, joining together and form collecting lymphatic vessels, then to the lymphatic trunk and lymphatic ducts. About all these members of the lymphatic system we will talking today. First of all, I'd like to remind you the structure of the microcirculatory bed was discovered during one of our first classes. During this class, as you remember, we were talking about the structure of the cardiovascular system and told that all vessels carrying blood from the heart to the organs are known as the arteries, and all the vessels returning blood back from the internal organs and tissues to the heart are known as veins. But in generally, the arteries and the veins, as the blood vessels, have got the common structure. Consist of three main layers: the internal tunic known as the tunica interna, then is the tunica media, and external tunic, which is the adventitial layer. Tunica intima consists of the endothelial cells. Tunica media consists of the elastic connective tissue fibers and smooth muscles, and outer layer is formed by the connective tissue. Then blood from the arteries passes to the arterioles, and arterioles giving rise to the precapillaries. Then these precapillaries branching out and form the network of capillaries. The capillaries are absolutely different from the arteries and veins. These capillaries form like the bridge in between the arteries and veins. What's the main difference? These capillaries are the single layer vessels because consist of the endothelial cells layer, and these endothelial cells sitting at the basement membrane. In between the endothelial cells, some gaps, some spaces present, and these spaces permit to exit of the liquid part of blood into the intercellular space or interstitial space, and by this way the exchange is occur. Then this liquid part of blood or interstitial fluid will return back to the venous portion of the microcirculatory bed. But the problem is metabolic products and products of the cell synthesis include not only the small molecules but some macromolecules like the proteins, like the fat, and so on. These molecules are quite big and cannot pass through the spaces in between the endothelial cells. That's why should stay in the interstitial space. But it will not occur really because of presence of one more member of microcirculatory bed represented by the lymphatic capillaries. You can see this greenish structure on this chart. So, as you can see here, these lymphatic capillaries have got blind origin or one closed end, like start from nothing, not like the blood capillaries connecting the arteries, the veins, but these got one close end. Then the diameter of the lymphatic capillaries is bigger than the diameter of the blood capillaries. And one more very important thing, the basement membrane of these lymphatic capillaries is modified and represented by the single filaments attaching to the connective tissue of interstitial space. These filaments help in regulation of the lymphatic outflow. If a lot of the fluid accumulated in the interstitial space, it causes to the tension of the filaments and increase the gaps in between the endothelial cells of lymphatic capillaries, and by this way increase the lymphatic drainage or returning back this fluid to the bloodstream. And this animation shows you how do the lymphatic capillaries act. You see here the endothelial cells and the gaps in between them increasing by the filaments attached to the endothelial cells. Then you can see the one-way valves present in the lymphatic vessels, and we will talking about it in our lecture. Here you can see how does lymphatic system act. As I told you before, everything starts in the interstitial space by the formation of lymph and outflow of it to the lymphatic capillaries. Then through the lymphatic vessels, this lymph gets to the lymphatic nodes, acting as the biological filters and stopping different foreign particles inside. Then lymph collected to the lymphatic trunks and through the lymphatic ducts will return back to the venous system in the blood circulation. This microphotograph shows you structure of the lymphatic vessel, and you can tell we saw different videos of surgery in different organs. We saw the dissection videos, but during these videos we can see clearly arteries and veins but never seen lymphatic vessels. What's the matter? This the vessel. That's why, as any vessel, the wall of lymphatic vessel contains three layers: tunica intima, tunica media, and tunica externa. Tunica intima is same like in the blood vessels. It consists of the endothelial cells and it forms the folding known as the valves, one-way valve, transmitting the lymph just in one direction. The next layer is a tunica media, and this tunica media is absolutely different from the arteries and veins, because it does not contain so many smooth muscular fibers. It contains just few of the smooth muscular fibers just in some places. That's why the wall of the lymphatic vessels is much more thinner than in the blood vessels. It is transparent. Inside of the lymphatic vessels is the lymph, which is also transparent fluid. That's why these lymphatic vessels are invisible and could be seen just if we'll paint the lymph by the special paint, or for example during special surgery, if it is necessary to find great lymphatic vessels of abdominal cavity, the patient have to use special lymphatic breakfast containing the fatty products as the milk, the sour cream, and so on. The next member of the lymphatic system is the lymphatic node. Lymphatic node is the special organ of lymphatic system. These lymphatic nodes could be different in shape, different in size. The size is variable from the 0.5 to 50 millimeters. It depends on the functional condition of the lymphatic node. In case of inflammation, it could be decreased. It also could be decrease of the metastasis, of the spreading of malignant cells and stopping it inside of the lymphatic nodes. These lymphatic nodes act as the biological filters and stop different foreign particles. It is the organ, that's why as any organ these lymphatic nodes have the hilum, where blood vessels, the artery enters and vein leaves lymphatic node. Also in the region of the hilum of the lymphatic node we can see the efferent vessels which carry out lymph from the lymphatic node. Opposite side of the lymphatic node, usually convex, contain the efferent lymphatic vessels, and it's very interesting fact, the number of the efferent vessels is usually 2 times more than the number of the efferent vessels. As most of the organs, lymphatic node is covered by the connective tissue capsule, and this connective tissue capsule gives off the septa or trabecules inside of the lymphatic nodes, dividing it into the lobules. Just deep to the capsule of the lymphatic node we can see the subcapsular sinus. Please pay your attention to the correct pronouns. It's subcapsular because it's just deep to the capsule. Because every year I'm hearing the same mistake. Quite often students confusing the subcapsular with the subscapular. I'll remind you, scapula is the bone, capsule is the outer layer of the organs, in this case the layer covering the lymphatic node. That's why the sinus is subcapsular. Next layer is formed by the cortex of the lymphatic nodes, represented by the lymphatic nodules. These lymphatic nodules contain the lymphocytes and another lymphoid tissue cells. In the center of the lymphatic node is the medulla, and it contains medullary sinus. After that, lymph moves to the hilum of the lymphatic node and through the efferent vessels, then continue its outflow. You can ask me why the lymph is moved. Because about the blood everything is clear. It moves because of the heart contraction which pumping the blood to the arteries. But why the lymph is moved? Because it does not contain any pumps. We have to remember about few mechanisms helping for passage of the lymph. And the first and most important maybe is the contraction of the skeletal muscles. It's pumping the lymph from the peripheral parts of the body towards the center. And you all know very nice situation after the long flight, around 8, 9 or 10 hours. If you are sitting without the movements, the swallowing of your foot, of your legs can occur. It's because the lymphatic drainage will be quite poor without the skeletal muscles contraction. The next factor which also helps to the passage of the lymph is the presence in the lymphatic vessels one-way valves. These valves prevent to the backflow of the lymph. One more very important mechanism is the contraction of the diaphragm, because days and nights this muscle continue to contract and like pushing the lymph from the abdominal cavity to the thoracic cavity, while the thoracic duct it makes the massage of the thoracic duct. Next mechanism which also helps in the lymph passage is the difference of pressure in the abdominal and thoracic cavity, because in thoracic cavity during the breathing some negative pressure is created which also help to move the lymph towards the thoracic cavity. And this microphotograph of the lymphatic node which also show you this peripheral pinkish color is the capsule of the lymph node. Then you can see the trabecules or septa inside of passing inside of the lymphatic node. Then this dark blue is the cortex, and you see the lymphatic nodules, and inside is the lighter medulla of the lymphatic node. So we were talking about the lymphatic capillaries, lymphatic vessels, and lymphatic nodes. And the next very important member of the lymphatic system represented by the lymphatic trunks. There are just 5 lymphatic trunks in the human body, and my advice to you, please remember it, because sometimes, especially during the human anatomy exam, it's very useful. If you have some difficulties to description of them, lymphatic drainage of some specific organ, to survive you, examiner can ask you question, what lymphatic trunks do you remember? That's why I think these 5 is not so difficult to remember. So what are the trunks? As I told, just 5, and most of them, 4 of them are paired and just 1 is unpaired. First one is a lumbar trunk, truncus lumbalis, which carries out lymph from the lower limbs and also the pelvis. Next is the subclavian trunk, also paired, truncus subclavius. It carries out lymph from the upper limbs. Jugular trunk, also paired, in Latin truncus jugularis, and carries out lymph from the head and neck region. Next is also paired bronchomediastinal trunk, truncus bronchomediastinalis, which carries out lymph from the thoracic cavity. And last one, unpaired, is the intestinal trunk. By the way, it is various and quite often could be absent. It is truncus intestinalis, which carries out lymph from the abdominal cavity. In case if this intestinal trunk is absent, the lymphatic vessels of the abdominal cavity can empty directly in the thoracic duct. And so we came to the next member of the lymphatic system, the lymphatic ducts. There are just two lymphatic ducts in the human body, the thoracic duct and the right lymphatic duct. This one thoracic and this one right lymphatic duct. You see, these two are not equal to each other, and a right lymphatic duct, as you can see on this diagram, provides lymphatic drainage just from the 1/4 of the human body, and the last 3/4 of the human body drain lymph into the thoracic duct. Such asymmetry in between the thoracic and the right lymphatic duct was formed in embryonic life during the organs of mediastinum formation. So thoracic duct, it originates in the abdominal cavity in the retroperitoneal space by matching of two lumbar trunks. It occurs approximately at the level of second lumbar vertebra. In the place of matching of these lymphatic trunks, of lumbar trunks, the expansion is formed. It is known as the cisterna chyli. After that, in the abdominal cavity, thoracic duct receives as well intestinal trunk if it is present. After that, thoracic duct rises up, piercing the diaphragm in the region of the aortic hiatus and enters to the posterior mediastinum. Passes upwards and in the thoracic cavity receives one more tributary, which is the left bronchomediastinal trunk. Then exits the thoracic cavity through the superior thoracic aperture and enters to the neck region, where receives left jugular trunk, then curves posteriorly to the left internal jugular vein, receives left subclavian trunk, and empties into the left venous angle, also known as the Pirogov's angle. It's a junction in between the left internal jugular vein and left subclavian vein, so empties in this place. By this way, lymph returns back to the venous system. Right lymphatic duct is much more shorter. It's usually 2 centimeters long, and sometimes it's completely absent. In this case, its tributaries empty into the internal jugular and right internal jugular veins directly. The tributaries of the right lymphatic duct are represented by right bronchomediastinal trunk, right subclavian trunk, right jugular trunk. And now we'll talking about the general principles of lymphatic drainage from the different organs and regions of the human body. And we'll start with the lymphatic drainage of the head and neck. Lymphatic drainage from the region of the head starts from the lymphatic capillaries, which are forming the superficial and deep three-dimensioned networks. The superficial is located in the skin and the deep in the soft tissues of the head. Then lymph is collected to the lymphatic vessels, and lymphatic vessels transporting it into the regional lymphatic nodes. The regional lymphatic nodes for the head are represented by the occipital lymph nodes located along the pathway of the occipital artery. Then mastoid or retroauricular lymphatic nodes located posterior to the auricle. Then parotid lymph nodes, quite big group of the lymphatic nodes, and you see here on this diagram the regions of the lymphatic drainage are painted by the different color, and you can easily understand from which area this or that regional lymphatic nodes receive the lymphatic drainage. Then buccal lymphatic nodes, also known as the facial, because they are located along the pathway of the facial artery and vein. Then quite big collecting group of the lymphatic nodes represented by the submandibular lymphatic nodes and submental lymphatic nodes receiving lymph from the center of the face, from the apex of the nose, from the central parts of the lips, from the chin, also from the central incisors and related part of the gums, also from the apex of the tongue. Then from the all mentioned groups of the lymphatic nodes, lymph drains into the lymphatic nodes of the neck. These lymphatic nodes are subdivided into the superficial and deep lymphatic nodes of the neck first. Then deep lymphatic nodes of the neck are also subdivided into the superior deep cervical lymphatic nodes and also the inferior deep cervical lymphatic nodes. Finally, from the cervical lymph nodes, lymph drains into the jugular trunk, as I told you before. Then, depending to the side of the body, from the right jugular trunk into the right lymphatic duct, from the left jugular trunk into the thoracic lymphatic duct, and corresponding to the side to the right and left venous angle. For illustration of the lymphatic drainage of the head, I'd like to represent you lymphatic drainage of the tongue because it's quite interesting. So, lymphatic drainage of the tongue starts from the system of the lymphatic capillaries forming superficial and deep network. Superficial located in the submucous layer of the tongue, deep inside of the intrinsic muscles of the tongue. From the lymphatic capillaries, lymph drains into the lymphatic vessels and then get to the regional lymphatic nodes. From the apex of the tongue, lymph drains into the submental lymphatic nodes, as I told you before, center of the face and apex of the tongue as well, submental lymphatic nodes. Then from the body of the tongue, from the lateral parts of the body into the submandibular lymphatic nodes, and from the central part of the body into the inferior deep cervical lymphatic nodes. From the root of the tongue, lymph drains into the superior deep cervical lymphatic nodes, also known as the retropharyngeal lymphatic nodes. After that, into the right and left jugular trunks, and then corresponding to the sides to the right lymphatic duct or thoracic duct, and corresponding venous angles. As the example of the lymphatic drainage from the neck region, let's talking about the thyroid gland. And this example can show you how important to remember about the blood supply of the organ. It's very useful to understanding of the lymphatic drainage. So thyroid gland, as you remember, located in the neck region, and it has got blood supply from two main sources. The first one is from the system of the external carotid artery via the superior thyroid artery, and the second one is from the system of subclavian artery through the thyrocervical trunk, which gives off inferior thyroid artery. Lymphatic drainage is provided by the lymphatic capillaries forming the superficial network in the superficial layer of the thyroid gland, just deep to the capsule, fibrous capsule, and the deep capillary network is formed in the parenchyma of this thyroid gland. Then through the lymphatic vessels, lymph gets to the regional lymphatic nodes. First group, superior deep cervical lymph nodes. You see the direction of superior thyroid artery, and inferior deep cervical lymph nodes, direction of inferior thyroid artery. These inferior deep cervical lymph nodes are subdivided or classified into the pretracheal lymph nodes in front of the trachea, paratracheal lymph nodes located besides of the trachea. Then lymph drains into the jugular trunk, as you remember, right and left, and then to the corresponding duct, right lymphatic duct and thoracic duct, and corresponding venous angles. Lymphatic drainage of the upper limb is also very nice developed. It starts from the capillary network in the skin and in the muscles of the upper limb. Then lymph collected to the lymphatic vessels, which carry it to the regional lymphatic nodes. And first group of the regional lymphatic nodes is represented by the cubital lymphatic nodes located in the cubital fossa. Then through the lymphatic vessels get to the second very important and very big group of the regional lymphatic nodes located in the axillary cavity and represented by 5 groups of the lymphatic nodes corresponding to the walls of the axillary cavity. What are the groups here? Pectoral group of the lymphatic node, then the humeral group of the lymphatic nodes, subscapular group of the lymphatic nodes, central group of the lymphatic nodes, and apical group of the lymphatic nodes. Then from these apical axillary lymphatic nodes, lymph drains into the subclavian trunk, and then depending to the side into the right lymphatic duct or into the thoracic lymphatic duct. Then next organ and next region, thoracic wall, and we are talking about the lymphatic drainage of the mammary gland, because it is, of course, the organ of the thoracic wall, and because unfortunately the problem of the breast cancer is very actual today. It is very important to put the diagnosis of the breast cancer as soon as possible, because sometimes the first symptom of the breast cancer is the increase in size of the lymphatic nodes. That's why not only the oncologist or gynecologist, but general physician during the general examination of the patient have to check conditions of the lymphatic nodes. Even the diagnosis of the breast cancer starts from the self-examination of the mammary glands, and females have to do it every month. And if we'll found any tumors inside of the breast, any tumors in the axillary cavity, have to attend the doctor to confirm the diagnosis. During surgery, it's very important to remember about the pathways of the lymphatic drainage from the mammary gland, because all lymphatic nodes have to be removed completely. So what are the main pathways? The main pathway of the lymphatic drainage from the mammary gland is usually from the capillaries to the vessels, then to the regional lymphatic nodes. Main direction: axillary lymphatic nodes, especially subscapular. But except this axillary direction, some extra directions present as well. So from the upper quadrants of the mammary gland, lymph can drain into the supraclavicular lymphatic nodes. Then from the middle quadrant can drain into the parasternal lymphatic nodes, and then to the anterior mediastinal lymph nodes. Then from the inferior quadrants of the mammary gland to the lymphatic nodes of the abdominal wall, and even from these abdominal wall lymphatic nodes to the lymphatic nodes in the superior story of peritoneal cavity. Even the cases of lymphatic drainage into the inguinal lymphatic nodes are described from the inferior quadrants of the mammary gland. From the middle quadrants of the mammary gland, lymph can also drain to the contralateral mammary gland and axillary lymphatic nodes of opposite side. That's why it's very important to check all these groups of lymphatic nodes in case of mammary gland cancer, breast cancer. Lymphatic drainage from the organs of the thoracic cavity. Let's look to the example of the lungs, because unfortunately the cancer of the lungs occurs quite often as well. First of all, because of the pollution of the environment. Again, starts everything from the lymphatic capillaries. Superficial network is located in the visceral pleura, and deep network in the parenchyma of the lungs. Then lymph drains into the pulmonary lymph nodes located inside of the lungs parenchyma along the pathways of the bronchi. Next group of regional lymph nodes located in the hilum of the lungs and represented by the bronchopulmonary lymph nodes. Next group in the region of the trachea bifurcation and represented by the superior and inferior tracheobronchial lymph nodes, depending to the location around the trachea bifurcation, inferior and the superior tracheobronchial lymph nodes. Then the paratracheal lymph nodes, and finally to the right bronchomediastinal trunk and left bronchomediastinal trunk. And as we all remember, right bronchomediastinal trunk empties into the right lymphatic duct, then to the right venous angle, and left bronchomediastinal trunk drains into the thoracic duct and then to the left venous angle. Lower limbs. Lymphatic drainage of the lower limbs a little bit similar to the lymphatic drainage of the upper limbs, and again represented by the very developed system of the lymphatic capillaries and lymphatic vessels starting from the foot. Then lymph drains into the regional lymph nodes, and first group of regional lymph nodes located in the popliteal fossa. That's why the name of these lymph nodes, popliteal lymph nodes. Then through the systems of the lymphatic capillaries, lymph gets to the next regional group of lymph nodes located in the inguinal region. These the inguinal lymph nodes, depending to relations to the fascia lata, superficial inguinal lymph nodes, and then deep inguinal lymph nodes. Then lymph drains into the external iliac lymph nodes, then to the common iliac lymph nodes, then to the lumbar trunks, and through the lumbar trunks into the thoracic duct. Pay your attention. Here no differences for the right and left, because right and left lymphatic trunks match together and form thoracic duct. From the abdominal wall, lymph also drains in two directions. And maybe you remember about the blood supply of the abdominal wall. One is the superior epigastric artery, which continues from the above located internal thoracic artery, and another one is the inferior epigastric artery, which is the branch of the femoral artery in inferior direction. So the lymph will drain in these two directions, upwards to the axillary lymph nodes from the upper half of the abdominal wall, and from the lower half of the abdominal wall into the descending direction to the superficial inguinal lymphatic nodes, then to the corresponding trunks and ducts. Inside of the abdominal cavity we can distinguish following collecting groups of the lymphatic nodes. If we're talking about the retroperitoneal space containing paired organs such as the kidney, suprarenal glands, also ureter, and also from the gonads, by the way, lymph drains into the lumbar lymphatic nodes, subdivided into the pre-aortic, para-aortic, precaval and paracaval lymphatic nodes located around the great vessels of retroperitoneal space. Then to the lumbar trunks, and finally to the thoracic duct. If we're talking about the organs of peritoneal cavity, which are unpaired organs of digestive system mainly, these collecting groups of the visceral lymphatic nodes are represented by the celiac lymphatic nodes located around the celiac trunk, superior mesenteric lymphatic nodes located around the superior mesenteric artery, and the inferior mesenteric lymphatic nodes located around the inferior mesenteric artery. And if you remember the regions of supply by the mentioned arteries, you can easily describe the lymphatic drainage from the organs supplied from the arteries. For demonstration, let's talk about the pancreas. So pancreas, maybe you remember, has blood supply from two main sources: from the system of celiac trunk via the superior pancreatic duodenal artery, and also from the system of superior mesenteric artery via the inferior pancreatic duodenal artery. So, lymphatic drainage of pancreas starts from the lymphatic capillaries, forming the network in the gland, then to the lymphatic vessels, and then to the regional lymphatic nodes. Superior pancreatic duodenal lymphatic nodes located around the corresponding artery. Inferior pancreatic duodenal lymphatic nodes located around corresponding artery. And quite important, quite big group of the lymphatic nodes located along the splenic artery. This group is represented by the pancreatosplenic lymphatic nodes. By the way, this splenic artery also gives off pancreatic branches to the pancreas. Then, from the mentioned groups of the lymphatic nodes to the celiac lymphatic nodes, and also superior mesenteric lymph nodes, then to the intestinal trunk, and finally to the thoracic duct. Very interesting and very important is the lymphatic drainage from the stomach, and also knowledges about the blood supply are very useful. As you remember, at the lesser curvature of the stomach, the anastomosis in between the left and right gastric arteries is formed, and corresponding groups of the lymphatic nodes present: left gastric lymph nodes and right gastric lymph nodes. At the greater curvature of the stomach, we can see right gastromental lymphatic nodes and left gastromental lymph nodes. You see, same like the arteries. Also prepyloric lymphatic nodes present, and maybe you remember corresponding vein carrying blood to the system of the hepatic portal vein. And posterior to the stomach, you can see mentioned in the pancreas group of the pancreatosplenic lymph nodes around the splenic artery. Then lymph is collected to the celiac lymphatic nodes, then into the intestinal trunk, thoracic duct, left venous angle. Lymphatic drainage from the large intestine. Large intestine has system of the lymphatic capillaries collecting lymph into the lymphatic vessels, and then through the lymphatic vessels lymph gets to the regional lymphatic nodes. First group of the lymph nodes sitting directly at the wall of the large intestine and represented by the epicolic lymphatic nodes. Second group is located in the place where vessels enter into the walls of the large intestine and represented by the paracolic lymphatic nodes, yellowish on this diagram. After that, next group of the lymphatic nodes are corresponding to the blood vessels, to the arteries, and represented by the iliacolic lymphatic nodes, right colic lymphatic nodes, middle colic lymphatic nodes. From these three mentioned group, lymph is collected to the collecting group around the superior mesenteric nodes, these superior arteries, superior mesenteric nodes. Then, from the left side of the large intestine, lymph drains into the left colic lymphatic nodes, then to the sigmoid lymphatic nodes and superior rectal lymphatic nodes, then to the collecting group, which is located around the inferior mesenteric artery, the inferior mesenteric lymph nodes, and then to the intestinal trunk if it is present, or directly to the thoracic duct, left venous angle. Quite interesting is the lymphatic drainage from the rectum, because maybe you remember three parts of the rectum have blood supply from the different arteries and same venous drainage to the different veins. That's why in this region some porta caval anastomosis are formed. So from the abdominal part of rectum, lymph drains into the superior rectal lymphatic nodes, then to the inferior mesenteric nodes, then to the thoracic duct. From the ampulla or pelvic part of the rectum, lymph drains into the presacral lymph nodes, then also to the superior rectal lymph nodes, then not superior rectal, middle rectal lymph nodes, then to the internal iliac lymphatic nodes, and then to the common iliac lymph nodes, to the lumbar trunk, and to the thoracic duct. From the anal part of the lymphatic nodes, which is related to the perineum, lymph drains into the superficial inguinal lymphatic nodes, then to the external iliac lymph nodes, common iliac lymph nodes, to the lumbar trunk, and finally to the thoracic duct. From the external genital organs in males and in the females, lymph drains into the external iliac lymph nodes, then to the first to the superficial inguinal lymph nodes, then to the external iliac lymph nodes, common iliac lymph nodes, then to the lumbar trunk, and to the thoracic duct. From the internal genital organs, most of the lymph drains into the system of internal iliac lymphatic nodes, then to the common iliac lymph nodes, then to the lumbar trunk, thoracic duct. But in the female's body, some interesting pathways present as well, because maybe you remember embryonic development of gonads starts in the lumbar region, and then the process of its descent to the small pelvis will start, and during this descending into the pelvis, the gonads pull the blood vessels, nerves, and also lymphatic vessels from the lumbar region. So that's why from the ovaries, lymph drains also directly to the precaval and paracaval lymph nodes, preaortic and paraortic lymph nodes, then to the lumbar trunk and thoracic duct directly. And the anastomosis between the vessels of the ovaries, also uterine tubes and angles of the uterus could be formed as well. That's why sometimes these anastomosis could be the pathways of malignant tumorous spreading. And now we'll start talking about anatomy of immune system. Immune system is very important system of our body which provides the function of immunity. The immunity is the special mechanism of the body's protection against the foreign genetically foreign information, genetically foreign substances, through the specific mechanism, specific reaction between the antigens and antibodies. You have to understand the difference in between the immunity and non-specific resistance. What does it mean? Non-specific resistance also protects our body, but it protects our body against absolutely everything. Absolutely everything which will enter to our body. For example, if you will eating the apple or banana and will not wash your hand before, will not wash the fruit before, some bacteria will enter to your mouth, but it will not obligatory cause to infection, because some mechanism of non-specific resistance starts from the oral cavity, because the saliva contains the lysosome which have to protect us. Then these bacteria will enter to the stomach. In the stomach the hydrochloric acid is produced, which is very aggressive, which have to destroy absolutely different foreign visitors of our body. And just if the level of this hydrochloric acid production is not enough, it can cause to infection. The next mechanism present in the duodenum, you know, maybe the medium of the duodenum is very aggressive because of presence of bile, because of presence of pancreatic juice. So this is the mechanism of non-specific resistance, but it does not include specific reaction in between the antigen and antibody. That's why it is not immunity. Then let's talking about the mechanisms, let's talking about the organs of the immune system. Immune system include the central and peripheral organs of immunogenesis. Please remember, central organs of immunogenesis are represented by two organs only. This is the thymus and red bone marrow. That's all. All another are the peripheral organs of immunogenesis. These peripheral include spleen, the lymphatic nodes, we were talking about it earlier. Then also scattered lymphoid tissue represented by the tonsils, by the Peyer's patches, by the vermiform appendix, and so on. Just thymus and red bone marrow are the places where the development and differentiation of the lymphocytes occur. Red bone marrow is located in the bones, in childhood in absolutely all bones, in adult just in the spongy flat bones and in the epiphyses of the long tubular bones. This red bone marrow contains polypotent stem cells giving rise to the different blood cells. It is located inside of the cells formed by the bony trabecules and limited by the bony trabecules. So bony trabecules keep the red bone marrow inside. It contains
Лимфоциты – это самые маленькие
polypotent
белые
blood
кровяные
cells
клетки.
which
Они чаще всего встречаются в
given rise
лимфатических
to
органах
the
и костном мозге.
different cells and
Лимфоциты разделяются на три вида –
especially.
Б-лимфоциты,
These
Т-лимфоциты и
lymphocytes is
клетки костного
represented
мозга,
by the B
включающие фагоциты,
lymphocytes, which
подавляющие клетки и
then
другие.
continue
Б-лимфоциты трансформируются в клетки
development
плазмы, чтобы
inside of the
формировать
bone
антитела,
marrow. Easy to
уничтожающие
remember.
чужеродные
B
для тела вещества.
lymphocytes, red bone
Т-лимфоциты
marrow,
вступают в
and
непосредственную
also
борьбу с
T
бактериями.
lymphocytes. T
Подавляющие клетки не
lymphocytes
позволяют лимфоцитам атаковать
after
вещества
the
самого тела, таким образом
development
помогая
in the
им бороться
bone
именно
marrow
с
then
чужеродными
will
веществами.
migrate to the thymus and the differentiation into the different subclasses like the T killer cells, T suppressor cells, and the auxiliary cells will continue inside of the thymus gland. The mechanisms of the immune response start from the phagocytosis, and after the destruction of these foreign particles, they are represented on the surface of these phagocytes as the special receptors giving rise for its recognition by the T lymphocytes. So after this process of representation, these receptors are recognized by the special cells of our body, by the T lymphocytes, and as the response of that, you see this, the foreign information enters to the cell, then it is recognized, the receptors are recognized, and here two mechanisms are possible. First, if directly T lymphocytes producing special cytotoxin and destroy the cells, and second, if it is also recognized by the another types of cells known as the B cells, and these B cells start to produce the special type of proteins known as the immunoglobulins. And here you see also the cell producing the cytokines which involve the cells to this infected agent. So the immunoglobulins, also known as the antibodies, will help to destroy genetically foreign agents. Antigens are the genetically foreign substances, and antibodies are the immunoglobulins produced by the B cells. And you have to understand two different mechanisms of immunity present in our body and represented by the cell-mediated immunity, which is produced by the T cells because of direct contact in between these foreign particles and these cells which producing the cytotoxins. And second mechanism, the humoral immunity, which is produced by the B cells by the production of the immunoglobulins. Humoral means in the fluid, because these Immunoglobulins are in circulation inside of the blood and lymph of our body. Another very important organ of central organ of immunogenesis is represented by the thymus gland, which is located inside of the thoracic cavity in the superior mediastinum, and it is represented by two lobes which are not equal with each other. You see on this picture, one is usually bigger, another less in size. And it's very interesting the development of the thymus in a postnatal period. In the newborn, the size, the weight of the thymus is approximately of 10 to 15 grams. Then it gets the weight 25 to 37 grams in age of 14 to 15 years old. So you see it increases approximately 2 times, because it's the period of from the newborn to this puberty is the period of most active formation of immunity. And then till the age of 40 to 50 years old, thymus undergoes gradually degeneration, and its size will, its weight will get just 5 to 6 grams. But it's very important, it continues functioning. That's why during the heart surgery, for example, it's not necessary to remove the thymus like they did before. They thought this is the fat tissue, that's not important, but then it causes to severe problems with immunity, because even in old age it continues functioning, not so active but continuous. Histologically, it consists of the capsule, covered by the capsule outside, which gives off the septum or trabecules separating the lobes of the thymus into the lobules. Inside of these lobules, peripheral part is cortex, and central is medulla. And inside of the trabecules we can see the special epithelial cells producing the thymic hormones. Next organ of immune system, quite big, is the spleen, located in the abdominal cavity, in the peritoneal cavity, and intraperitoneal, covered by the peritoneum. It is projected to the left side of the thoracic wall, in between the 9th and 12th ribs. It has the hilum, where the blood vessels enter to the spleen. These blood vessels are very massive, supplying it by the blood. That's why in case of trauma of spleen, it's very important to put the diagnosis at the time, and then unfortunately the surgery of spleen is hardly possible. That's why usually in case of spleen rupture, it's completely removing the splenectomy have to be performed. Histologically, it consists of the red and white pulp. It is very nice supplied by the blood vessels, by the capillaries, the sinusoids, similar to the capillaries inside of the liver. And spleen is very important in embryonic life. It participates in hematopoiesis. In the postnatal period, it's very important for selection of the blood cells. It destroys the old, especially red blood cells like the erythrocytes, and send it to the liver, where the hemoglobin of these destroyed erythrocytes will transform into the bilirubin and released with the bile from the body. The differentiation of lymphocytes also is taking place in the white pulp of the spleen, and you can see here the lymphoid follicles. Lymphoid tissue, as you remember, is present in the walls of the gastrointestinal tract and represented by the solitary lymphoid follicles and also by the aggregated lymphoid follicles or pairs patches. A lot of the lymphoid tissue present in the walls of the vermiform appendix. That's why it's not rudimentary organ, and it is prohibited to remove it without the inflammation. Just in case of acute appendicitis, it has to be removed, but without the disease, its removing is prohibited. That's all I'd like to tell you today. Thank you very much for your attention. Good luck to you. Take your care. Bye bye.